Hola, ¿qué tal? Tenemos la gran oportunidad de contar con el doctor Jatin Shah, directamente de el Memorial Sloan Kettering Cancer Center en Nueva York. Esta es una visita sin precedentes en México, ¿no? Les digo, aquí en el Instituto Jalisciense de Cancerología va a marcar al instituto, creo que para toda la vida, a todos los cirujanos de cabeza y cuello, y pues seguir adelante con ejemplos como él que incansable, dice, cansado de cuerpo, pero con mente joven. Dr. Jatin Shah, thank you again for visiting us here in Guadalajara at the Instituto Jalisciense de
Well,
Cancerología.
it's my pleasure and it's an honor to visit you. I'm impressed by your institution. It's a beautiful facility and your program, which is training a lot of young surgeons, which is what you need in Mexico, where the incidence of cancer in the mouth is rising.
Yeah.
And you're going to need energetic, well trained young surgeons and oncologists to take care of this disease.
And in this sense, as a global leader in this field, head and neck surgical oncology, what do you recommend for countries as us, like Mexico?
Well, all over the world, the focus of cancer treatment has changed. Several decades ago, when I was in training, the only goal was cure cancer and nothing else mattered. Now it's different. You are not only wanting to cure cancer, but you want to maintain the quality of life because the body may be living, but the body is not having a life. So, a great emphasis in treating cancer, either with surgery or radiation or chemotherapy, keeping in mind that patient remains functional, swallowing, hearing, smell, speech, facial appearance. All of these are important for quality of life. So, modern day treatment of cancer requires a multidisciplinary approach where the surgeon removes the cancer and restores or reconstructs the function. The medical and radiation oncologist add the treatment to reduce the risk of recurrence. And we are giving longer life to the patients with better quality of life. And that's the goal.
This effort of an institution or multidisciplinary teams, we cannot get farther.
True, but I think cancer is a disease which is not likely to be treated effectively by one doctor.
Yeah.
Because you need the help of multiple specialists to address different issues. The surgeon can cut out the cancer, but we have to make sure that the function of swallowing, speech is retained or reconstructed. For example, if you remove the jawbone, that is easy. But reconstruction requires putting the bone together, putting the teeth inside so the patient can smile, patient can eat, chew, and live a normal life.
Talking about the course that we are, do you think this type of education, continual medical education, works in everywhere?
Absolutely. I'm amazed at the interest the young surgeons are taking during this course. Even during the coffee break and lunch break, they come around and ask questions, and that means they are interested. I didn't see anybody hanging around the hallway while the sessions were going on. They were all glued to their chairs, wanting to absorb knowledge. They are like dry sponges wanting to absorb the knowledge and the wisdom and the experience.
I want to tell you that for the Instituto Jalisciense de Cancerología, it's going to be a before and after your visit because this represent for us a great opportunity
Of course.
to keep growing
Yeah.
in low knowledge experience. So thank you again,
Yeah.
Dr.
It's
Shah.
my honor and a pleasure. And I think I'm not only impressed, I'm stimulated by the effort that you are putting in and the results of the effort seeing in the young doctors, who are enthusiastic. They want to do something. They want to learn more. They want to travel. I think this is great. My compliments to you.
Okay. Thank you again.
My pleasure.